Imagine being at the end of your life, in pain, scared, and just wanting some relief. And the one thing that could help is sitting in a pharmacy because of a small mistake on a piece of paper. I work in a hospice pharmacy, and this happens way more than people think. Doctors often send prescriptions with doses that don't make sense. Like when they send morphine and the prescription will say, take 0.25 mLs every 1 hour. But then the milligrams don't match the concentration. Or when they send diclofenac gel without clear grams written down, because you have to apply diclofenac gel in gram increments onto the affected area. When the numbers don't add up, we legally can't fix it, especially with controlled substances. We have to sit on hold, explain the issue, and wait for a new prescription. In hospice, minutes matter. Patients are not just uncomfortable, they're literally actively dying. Pharmacists should be allowed to correct and adjust clearly identifiable prescription errors for patient care and safety. Today, I will be explaining how often prescription mistakes happen, why pharmacists are typically the ones who catch these errors, and how allowing pharmacists to correct these errors could reduce delays, stress, and prolonged suffering. When pharmacists identify a obvious dosage error and they know the exact dosing needed to fix the mistake, but instead they're required to wait while a patient remains in pain, I feel like that's when you begin to see the flaws in the system. The real issue isn't that mistakes don't happen or even that they do happen. Mistakes are human. The issue is that the professionals that are trained to catch those mistakes aren't allowed to. Prescription errors happen a lot, more than people actually realize. The FDA estimates that over 1.5 million people are harmed each year by medication errors in the United States. Even something as small as mixing up the milligrams and milliliters can cause prolonged delays or serious harm. Pharmacists are literally the last line of defense. Pharmacists are extensively trained in pharmacology, dosing calculations, dose interactions, and therapeutic safety. In a hospice setting such as mine, we work with high alert medications like morphine and lorazepam every single day. Therefore, pharmacists are often able to immediately identify when a dose or concentration calculation is incorrect. However, despite knowing and identifying the error, we are legally prohibited from correcting the most obvious dosing errors without receiving a prescription from the doctor. If pharmacists are already identifying and correcting as well as preventing harm, that's when the question becomes, why not allow them to fix a clearly identifiable mistake safely and professionally? They should allow pharmacists limited authority to correct obvious dosing errors. For example, I've seen a doctor send in Oxy 5 milligram prescription with dosing that says, take 1 tablet by mouth every 1 hour scheduled, but then they'll only send 10 tablets, which is usually a comfort kit. Even though we know the indications of it being a comfort kit because it's not written as a comfort kit, then we have to call the hospice, find out, hey, is this actually scheduled because you only sent 10 tablets? Like 10 tablets isn't going to suffice. 1 tablet every 1 hour because 24 hours in 1 hour time period. So even though the pharmacist can clearly tell that it's a comfort med, we would still have to call and get clarification from the doctor and wait on a new prescription. Now, some states already allow collaborative practice agreements between physicians and pharmacists that would actually allow the pharmacist to switch this over and go ahead and write down that it is a comfort med with extensive documentation. So that actually already shows that this system being implemented could work. If we create strict guidelines and documentation requirements for pharmacies, we already document pretty much everything that there is to document when working in a pharmacy, as well as very strict guidelines that we already do have to follow. Now, implementing this change would not mean that pharmacists could diagnose or freely prescribe. It would only mean that they could fix clear calculation or dosing errors with required documentation and physician notification to maintain responsibility. Now, some will argue that allowing pharmacists to adjust prescriptions could be unsafe or overstep physician authority, but pharmacists are trained to catch what others typically miss, such as incorrect doses, mismatched milligrams, dangerous interactions. In hospice, we work with high alert medications every single day, like hydromorphone. We can look at prescriptions and instantly know when something is off. Prescription errors are common. Pharmacists are trained to actively catch them. Current laws prevent pharmacies from fixing obvious mistakes. I believe allowing limited corrective authority to pharmacies that could reduce delays and prolong suffering to patients. I see these patients every week. I see families crying, wanting relief for their loved one. I've seen them do the honorary walk of life around the entire hospice, and I cannot count the amount of times I've typed up these prescriptions and seen the errors that I know my pharmacist knows how to fix but legally can't. That's not just frustrating, it feels wrong. We should support policy changes that allow pharmacists to correct clearly identifiable prescription errors so patients, especially those in hospice, can receive faster and safer care. At the end of someone's life, comfort should never be delayed by paperwork, when relief is just one corrected number away. Somewhere tonight, a family is standing around a hospital bed, holding someone's hand, whispering goodbye. They aren't thinking about regulations. They aren't thinking about milligrams. They're just praying for comfort. And that comfort is sitting in a pharmacy because of a number that doesn't match. We can do better. Thank you.